You are now listening to the Protestant Libertarian Podcast. All right, guys, welcome to another episode of the Protestant Libertarian Podcast. It is great to have you guys on the show today. I want to take a few minutes in today's episode to finally fully address COVID-19. I feel like I have danced around it on the show. It's come up in some conversations that I've had with previous guests, and I did an episode where we talked about the philosophy of science, and of course, we talked about COVID-19 on that episode. But today, there have been a couple of articles that have come out that I think have done a really good job of summing up a lot of the concerns that I've had personally about the entire COVID routine. And I wanted to take a moment to address those articles. And again, I apologize. My voice is going to sound pretty rough this afternoon. This is a Friday afternoon after I've been teaching all week long. And this is usually what my voice sounds by the time I'm done with the end of the week. So I apologize for the gravelly, raspy voice today. But I really just wanted to take a few minutes to talk about why I think the entire response to COVID was wrong-headed and why I think that it actually led to a lot more pain and suffering than it ought to have. And I think that our entire way of looking at health in American society is completely skewed by our cultural context. I think that we have a very deficient understanding of health. And for me, I have for the last 10 years or maybe even a little bit longer than that, since I was 18, 19, 20 years old, I've just been aware of the fact that I need to take care of myself and I need to watch what I eat and I need to exercise. And really, it's been within the last 5 or 6 years that I've gotten into a very good workout routine and really cut back on a lot of the bad substances that I had in my diet. And a large part of this for me was about 5 or 6 years ago, I started developing really bad heartburn. And at this point, I was eating lots of fruits and vegetables. I was exercising almost every day of the week. I've been very active, physically active as an adult. So I've never had a sedentary lifestyle or anything like that, but I started to develop really bad heartburn, and it was basically any time that I ate any food at all, I would get this heartburn, and it was with me for a couple of years. And I went to the doctor, and when I went to the doctor, they told me that I could be on heartburn medication for the rest of my life, and that was essentially the only solution that they had for me. And at this point, I was already pretty skeptical about a lot of pharmaceutical products because they all have really nasty side effects. And I didn't want to put this heartburn medicine in my body for the rest of my life because it came with a lot of really negative potential side effects. And so I went to a holistic doctor a few years back, a really great guy who looks at nutrition and who looks at all kinds of other factors. And I took a bunch of tests with him, and it turns out that I had gotten like strep throat a long time ago, and it just hadn't left my system for whatever reason. Maybe I didn't eat right, or there was some reason why that strep was still lingering in my system, but he was able to give me some diet modifications. I went gluten-free for a while, and I took some minerals and things like that, all completely natural. And after a couple of weeks, my heartburn was gone, and it hasn't come back. And that was a really big turning point for me in terms of just understanding how bad foreign substances and synthetic substances are for our body. And I'm a little bit of a health conspiracy theory. Like, I gave up all processed sugar 4 years ago, so I don't eat anything with white sugar in it. That's all sweets and all of that stuff. And I'm pretty much, except for the occasional beer, completely gluten-free. I don't eat dairy or anything like that at all. And I know that what's ironic about the COVID-19 pandemic is that like 10 years ago, my conservative friends would have called me like a crazy radical hippie for eating like that. But now, after seeing how all of these substances have been portrayed in the media, I think there are a lot of people that are more open to holistic ways of living. And so, like, my entire framework going into the COVID-19 epidemic was I did not trust the pharmaceuticals that are often given when people go to the doctor because they're all synthetic and they all have really nasty side effects, and a lot of them are not compatible biologically with our system. So I had that kind of skepticism towards medicine. And then also, I know that you have to have a well-balanced diet full of nutrients if you want to be completely healthy, and you actually have to exercise on a regular basis, and then also drink lots and lots of water. Like, all of these things are the key to being a healthy person. And when COVID-19 started in March of 2020, the governor of the state of Kentucky, the state that I'm in, Andrew Beshear, he got on the television and said that Kentuckians needed to go outside and get exercise, and that they needed to eat right, and that was the most helpful thing that you could do to stop the spread of COVID-19. And I was like, I completely agree with that narrative. narrative. And from the very beginning, I was not worried about the pandemic because as soon as we started getting information about it, even though in the earliest stages of 2020, the information was all kind of shrouded in mystery, and there were a lot of stories about people randomly dying in the streets, but then there was never any evidence to back that up. And it really did seem to me like a lot of the media coverage of COVID-19 was sensational and kind of designed to create a panic. And then once I started seeing what COVID-19 actually did to the people that I knew that got infected, I realized, like, look, this is like any other illness. If you're a healthy person and you eat right and you take care of yourself, then you probably don't have a lot to worry about. And over the last couple of years, that narrative has been completely vindicated by the research that has been done. And so all throughout the pandemic, all of these like non-pharmaceutical interventions and all of this stuff, like no one ever actually addressed the fact that Americans are just really, really, really unhealthy in general. And I think that that was a really key component of the COVID narrative that was just lost. And so I did some research on this early in the pandemic, and I looked at some of the statistics that the CDC itself provided about things like hydration and obesity and things like that. And based on statistics that are released by the CDC, and I'll put links to these in the show notes, the majority of Americans are like chronically dehydrated all the time. So most Americans are not drinking the recommended amount of water every day, which is like 8 cups of water. It's not that hard to do, but most Americans drink way less than that. Over 50% of Americans are either obese or overweight right now. And again, I've read other studies that weren't published by the CDC that actually put that number much higher. And just based on, the anecdotal observations that I have when I'm out in public, I think that there are probably a lot more overweight or obese Americans than 50%. But that's another factor to consider. And then another really important one too is that the majority of Americans are not getting regular physical activity more than 3 times a week. Like most Americans live a relatively sedentary life. And all of these factors contribute to how well your body can respond when you get sick with anything, including COVID-19. And COVID-19 is not a special illness. It operates by the same rules as every other illness. If you have a strong immune system and you're a healthy person, then you really don't have much to worry about. And so from the perspective of someone who is completely bought into holistic health, which I have, and again, I'm not judgmental towards people that don't. I understand that it's a very radical perspective, and we've been taught to think that like since that synthetic foods and like processed foods can be good for us, and they just can't. And again, I'm not 100% perfect with this. Like you have to buy some processed foods, at least at the income level that I am in right now. I have to buy some processed foods, but it's just common sense that if you are a healthy person and your immune system is working the way that it ought to, and you're hydrated and you're getting plenty of nutrients from your food and you are exercising on a regular basis, that even if you're an older person, COVID-19 was not ever really a threat to you in the same way that the flu is not really a threat and the common cold was not really a threat. But it was really interesting to me from the beginning of the pandemic that narrative was there at the very beginning, where people said, like, okay, if you're healthy, you probably don't have a lot to worry about. But then it immediately switched. Like in March of 2020, when the lockdowns happened on Friday the 13th, the narrative immediately switched to everyone needs to mask. We need to find some sort of pharmaceutical intervention, and we're not going to talk about exercising or dieting or anything like that ever again. And the narratives were just completely changed. And I wondered why that happened, because it just seems so obvious to me all the way through there that if Americans just changed their diet and tried to eat better and got regular exercise, that they wouldn't need to be so nervous about it. And it was just really difficult for me to understand why we could not get past that narrative that this disease was just debilitating for healthy people. There was no research other than some of the propaganda that was put out there by the mainstream media that this was ever going to be a problem. And so for me, there had to be, I understood very early on that there probably had to be a political calculation to this, and there probably had to be some sort of financial problem associated with this as well. And so I did some research early on the FDA, because the FDA is the organization, the Food and Drug Administration. They're responsible for approving all of the pharmaceutical products that make it to the American market. And so if you don't have an FDA approval, your product either doesn't get to be sold in the United States, or it's sold with a label that says that the product was not approved by the FDA. What's really interesting about the FDA is that they have, and this is based on their website, and I'm going to leave a link to this for you guys to take a look at, but based on their own website. The FDA is not completely funded by Congress. So I think that they're given about $3 billion a year in funding, but the rest of the FDA's budget is paid for by industry users. So in other words, the companies that the FDA are supposed to be regulating are companies that are actually paying for that regulation. And again, if you're a libertarian, you understand how this system works. What this means is that it's just like with the military-industrial complex. What this means is that these incredibly wealthy and incredibly well-connected pharmaceutical companies can essentially pay off the bureaucrats that work at the FDA to approve drugs that these pharmaceutical companies know they can make a profit on. And so for every single category of regulation for the FDA, whether it's they do like animal drugs and feed, tobacco, foods, human drugs, and things like that, they have a breakdown on their website as to how much of that regulatory budget is given by the Congress and how much of that regulatory budget is paid by industry user fees. And if you look at human drugs, pharmaceuticals, only about 33% of the money that is used by the FDA, only about 33% of the money that is generated for the FDA for regulating human drugs is paid for by the budget authority of Congress. And the rest of it, about 66% of it, comes from user fees. So you can see that like these companies like Pfizer and Moderna, they're going to get privileged treatment because they're literally the ones paying for FDA regulation, which means that the FDA is going to privilege the companies that are paying those user fees at the expense of other competitors in the market. And I think that this is one of the reasons why, at least for the last 20 or 30 years, the government has been all in on big pharma, and the government has been pushing all of these pharmaceutical products on people instead of telling people to get healthy and eat right and diet and exercise and things like that, because these pharmaceutical companies don't make any money on people being healthy. And in fact, like if you go to the doctor, it's like my experience with heartburn. Like I went to the doctor and the doctor did not recommend any sort of dietary or lifestyle changes. He just offered me a drug that I would have to be on for the rest of my life. And that would cost me a lot of money over the course of my life. And so there is a massive financial incentive to push pharmaceuticals. And this is completely created by the regulatory scheme of the FDA. And it was very obvious to me from early on in the pandemic that the economic incentives that are associated with these big government organizations being completely captured by massive corporations could only wind up pushing that COVID narrative in one direction. And it was very obvious just looking at independent research outside of the official narrative that was propagated by the CDC and by the NIAID and by the FDA. And then obviously that was pushed on CNN and MSNBC and even Fox News. Like the mainstream corporate press did not do a good job of covering COVID-19. But it was very, very obvious to see that there was a concerted effort that would directly benefit certain people within the population at the expense of others. And I think that it was very obvious that they were trying to gin up pandemonium about this COVID-19 epidemic in order to at least partially sell pharmaceutical products. And there's been a lot of independent research since that has taken place that has only confirmed my thesis. So all you have to do is take a look at like the FDA's budgeting system to see just how corrupt this system can be. Not to mention the fact that in the early 90s, Congress passed a law that exempted all pharmaceutical companies from any sort of liability from adverse effects that take place because of their drugs. And then also the fact that members of the National Institute of Health and their subsidiary organizations like the NIAID that Dr. Fauci worked for can collect kickbacks, royalties for life on pharmaceutical products that they help develop. So there's all kinds of perverse incentives to push vaccines and to push other sort of pharmaceutical programs instead of just telling people that they needed to get healthy and take better care of themselves, which is obviously a lot harder for the average person, but it's much more effective when it comes to protecting yourself, not just from COVID-19, but from every illness. So before we get into a couple of articles that I've read recently that I wanted to talk about, I just had to lay that out. And again, it's also really interesting. I just got done reading Michael Rectenwald's book, The Great Reset, which is about the World Economic Forum and about the decision makers that global politicians and corporate leaders and celebrities make every year when they go to Davos and try to push on world governments. And what's really interesting is that in both 2018 and 2019, there were two events. Clade X was in 2018, and then Event 201 was in 2019. And the World Economic Forum did these events in combination with an organization out of Johns Hopkins and then the Bill and Melinda Gates Foundation. And both Clade X and Event 201 were pandemic simulations where they essentially mapped out what a respiratory pandemic would look like and then came up with appropriate government strategies for dealing with that kind of pandemic. And the plan, and these are not events that, this is not like a conspiracy theory. You can look this up on, I think, the World Economic Forum's website. Like these are events that they promoted themselves. But with Event 201 and Clade X, they came up with the playbook that they would use for COVID-19, where you would have lockdowns, you would have the restriction of information on social media to conform to the predominant narrative. You would have the development of a vaccine and the distribution of a vaccine. So everything that took place after COVID-19 reached the United States in 2020 was just based on a script that the World Economic Forum, the Bill and Melinda Gates Foundation, the World Health Organization, Johns Hopkins, and a bunch of other groups had already written before the pandemic started. And like, for me, that should be a sign that something suspicious was happening here. That, I'm not someone that thinks that the disease was deliberately released from the lab in Wuhan. I do think that it was created by United States taxpayer-funded research in China. I don't think it was deliberately released. I think it was an accident. But it's very interesting that they already had a script and they followed that script to much destruction and devastation once the pandemic came to the United States. And we also have talked on the show before about how science was kind of used throughout the COVID pandemic in the same exact way that like super fundamentalists use the term Bible. So like if you go to a super fundamentalist church, they'll say, well, the Bible says it, and that completely ends any potential that you'll have a conversation or any follow-up questions about whatever theological proposition you might be addressing. And the word science was thrown around by those in authority throughout the COVID pandemic to denote not like actual scientific information that was based on, research and based on experience, but science was used just as a way of giving the stamp of approval to the official narrative. So whatever the official said was the science. And even if there were independent researchers that were coming to radically different conclusions about the efficacy of the vaccines, about the actual death toll of COVID-19, about the kinds of people that were actually at risk, about the non-pharmaceutical interventions that people could take to mitigate the risk of COVID-19, like that was deemed as being anti-scientific, even though it was actually done using the scientific method. And we talked about that. I forget what show it was. I'll put a link to it in the show notes here. But essentially, we looked at Thomas Kuhn's Structure of Scientific Revolutions. And in that book, Thomas Kuhn kind of explains how science works. And the conclusion that we came to is that science is a method that allows us to analyze phenomenon that take place in the natural world. The problem is that scientific method produces data, but then that data has to be interpreted into a larger intellectual framework. And so Kuhn is going to argue that science can't be objective because that data that is produced by the scientific method has to be interpreted by subjective human beings. And so scientists argue and disagree all the time, not necessarily on the results of a particular study or a particular experience, but on how to interpret the results that they got from that. And a lot of the messaging that was put out by the mainstream media and by the public health establishment during the COVID-19 epidemic was obviously deliberately manipulated information that was designed to create a panic in people so that they would get these COVID-19 mRNA vaccines that it has been proven don't actually work like they were like they were suggested. And again, I'm not vaccinated, and I remember back to it was about this time last year I got COVID, and I had been reading a lot of independent literature, and the independent literature that I had been reading had said that if you came down with COVID, you took vitamin C, vitamin D, zinc, and then if you get it, ivermectin. And of course, the FDA shut down ivermectin because they would not have been able to get an emergency use authorization for the COVID-19 vaccines based on FDA regulation because the ivermectin actually treated COVID-19. And according to FDA regulation, you cannot give an emergency use authorization to a pharmaceutical product if there's already another pharmaceutical product that treats the same illness, which is the reason why they had to nix takes ivermectin. That's the truth about ivermectin. So I took vitamin C, I took vitamin D, and I took zinc in higher levels when I found out that I got COVID. And I drank a lot of water. I ate good food like I usually do, my fruits, my vegetables, my good proteins. And I was able to exercise every day during COVID, and I didn't have any lingering symptoms. It took about 5 days for me to get back on my feet fully, and I felt fine. And that was, to me, a good indication that I followed the actual scientific data and not just the label of scientific that the authorities used to legitimize the dominant narrative. Again, the completely disingenuous use of the term science. And that's what we're going to get to on the show today. There was a really interesting article that came out. I think it was in the Wall Street Journal. I'm going to put a link to it. I actually had to print a copy of it because the Wall Street Journal would only let me see it one time before it kicked me out of their website. But it was an opinion piece that was called "The Vicious Circle of COVID Bondoogles and Bad Data." And the subtitle says, "Medicare bonuses and FEMA funeral benefits create incentives to overstate the disease's toll." And so the authors of this article are going to argue that because of the incentive system that was created by the federal government, it was very easy to overstate the extent of this COVID-19 pandemic. And I think that this article, which isn't very long, just captures perfectly how the predominant narrative of these authoritative figures having science on their side in this sort of absolute epistemologically arrogant sense just did not work. They were wrong about almost everything, and the incentives that they set up only perpetuated that wrongheadedness that the official narratives that were crafted by our leaders wanted to tell us. So we're going to go through the article here. I'm going to stop and give a couple of comments on it. It's not very long. And then I have a couple more points that I want to make. I'm going to try to make this a little bit of a shorter episode today. But we're going to get into this article, and then we are going to think about COVID-19 and all of the issues that are related to that. So the article begins, "Public health experts are increasingly acknowledging what has long been obvious. America is overcounting hospitalizations and deaths from COVID-19. Hospital patients are routinely tested for COVID on admission, then counted as COVID hospitalizations, even if they are asymptomatic. When patients die," Lena Wynn notes in a Washington Post column, "COVID is often listed on their death certificates, even if it played no part in killing them. Government programs create incentives to overstate COVID's toll, and poor data make it difficult to pinpoint who's still at risk and how effective boosters are." And again, we have known this for at least a year and a half. And I remember that a year and a half ago, you would have been labeled a conspiracy theorist to say this in public. And I remember having debates with some of my really good friends where I said, look, they're PCR testing literally everybody that goes to the hospital. And if you die in the hospital, they're going to PCR test you. And if it turns out that you were positive with COVID, it doesn't matter if the cause of death was a gunshot wound to the head. It's going to go into the COVID statistics as a COVID death. And so why would they make these horrible decisions, and why would they do this? The article is going to go on and explain the economic factors and the political factors behind these errors in counting COVID deaths. So they say the UC San Francisco hospital system uses remdesivir, a COVID-19 antiviral, as a similar proxy. And I've heard some mixed reviews about remdesivir. I have heard that it can be very toxic as well. But in this article, I think they're gonna argue that remdesivir has a positive therapeutic effect. They say that yields higher numbers since remdesivir is given to patients with milder symptoms. UCSF doesn't report detailed data publicly, but hospitalizations from COVID are typically less than half of COVID-positive patients. When the CDC reports data from states, it ignores these efforts to discern which hospitalizations were actually caused by COVID, which again, people like me that have been tracking the statistics since the beginning have been saying all along. They don't care whether or not you were at the hospital because you have COVID. All that matters is whether or not you get a test and test positive when you're at the hospital. The CDC data tracker, they continue, also uses state-generated data in reporting hundreds of daily COVID deaths. Many states report a COVID death anytime the descendant had a positive PCR test in the month or two before dying. The National Center for Health Statistics, a CDC subdivision, uses death certificates which are more reliable. But death certificates have problems of their own, in part because government policies create incentives to overcount. So again, this is crazy that states were tracking these COVID death data. And if you remember, like they had a running ticker on every state website and on every local news station about COVID deaths every day during the pandemic. But in many states, if you tested positive with COVID 2 months before you died because you fell off of your roof and hit your head, they would cause that, or they would label that as a COVID death. And again, it was very obvious to people that have my perspective on government and on the incentives that these government programs create, that this was obviously what was happening, because I saw hundreds of people get COVID that weren't even very sick from it. And so the information just did not line up. And so I think it's so important to point out just how ridiculous the accounting for COVID deaths were during the pandemic. They're going to continue. Under the federal public health emergency, which begins its 4th year on Friday, hospitals get a 20% bonus for treating Medicare patients diagnosed with COVID-19. That made sense at the beginning of the pandemic, when hospitals were swamped with seriously ill patients, subjected to arduous protocols and losing money from canceled elective procedures. It's rational under current circumstances. Hospitals are under no obligation to test all admitted patients, and CDC guidance on the question is ambiguous. They should end routine testing for COVID and test only those patients who are admitted for respiratory illness for whom a COVID-19 diagnosis would guide treatment. Withdrawing the financial incentive to test would speed up the process. Another incentive to overcount comes from the American Rescue Plan of 2021, which authorizes the Federal Emergency Management Agency to pay COVID-19 deaths benefits for funeral services, cremation, caskets, travel, and a host of other expenses. The benefit is worth as much as $9,000 a person, or $35,000 a family if multiple members die. By the end of 2022, FEMA had paid nearly $2.9 billion in COVID death expenses. So again, every time you throw money at a problem like this, there's going to be the incentive for hospitals and for families to overcount COVID-19 deaths, which they did. They continued. Funeral homes, mortuaries, and state health departments widely advertise this benefit on their website, as does FEMA. By contrast, the agency barely advertised funeral assistance to hurricane victims. And while around 80% of requests for COVID death benefits have been approved as of January 1st, some 80% of applications following Hurricane Harvey, Irma, and Maria in 2017 were denied. So again, because of this COVID-19 pandemic, they were willing to approve all requests for COVID death benefits while they denied almost all of the applications for hurricane assistance after these major hurricanes in 2017. FEMA offers no death benefits, they're going to say, for the flu, HIV, or any other infectious diseases. Several physicians told us that they are concerned that hospitals are being pressured by families to list COVID-19 on the death certificate. Just try and leave COVID off the death certificate of a person who is asymptomatic, positive, and died in a car accident, one infectious disease doctor said. Just try. No one was willing to be quoted by name, unsurprisingly, since the implication is that their hospitals are falsifying death certificates. I mean, it makes perfect sense given the information that we have. These programs create a vicious circle. They establish incentives to overstate the danger of COVID. The overstatement provides a justification to continue the state of emergency, which keeps the perverse incentives going. With effective vaccines and treatments widely available, and we're going to talk about the vaccines in a second, and an infection fatality rate on par with flu, it's past time to recognize that COVID is no longer an emergency requiring special policies. So they did a great job of outlining just how perverse the incentives of counting COVID deaths were based on the economic incentives that were offered to hospitals and to individual families that were suffering from COVID-19. What's really interesting about the article, though, is that they don't take the next step and think about the incentives of the vaccines. So going back to what we said earlier about the way in which the FDA is completely controlled by these pharmaceutical companies, and they are in the exact same way that the American military is completely controlled by the military-industrial complex, by Raytheon and Northrop Grumman and Boeing. I mean, they're really the reason why we've been at war in the Middle East for 20 years, and they're really the reason why we're in war. We're in a war with Ukraine right now, or we are, funding a proxy war in Ukraine right now. It's in order for these companies to make money. There's no real national security threat, and there never really was a real national security threat to us. This was all just a guise for them to make money. So with the vaccines, obviously, these pharmaceutical companies made an absolute killing on it. And it appears, based on the evidence that we have now, that people like Anthony Fauci, who refused to disclose how much money he received in royalties from the pharmaceutical companies after 2020, he didn't say how much that he got. And he refused to disclose how many people that worked for the NIAID received royalties from the pharmaceutical companies after 2020 for these COVID-19 vaccines. But again, it was very easy for me, going back to the idea that holistic health is the best approach to our health. That if you are a very healthy person and you eat the right foods and you are hydrated, you exercise on a regular basis, COVID-19 was never at all really a threat to you. And I think that that's a really, really important point to make here. Now, with the COVID-19 vaccines, when they were first rolled out, we were told by many, many doctors that the COVID-19 vaccines would 100% prevent infection, 100% prevent transmission, and 100% did not have any sort of negative long-term side effects. Now, there has never, ever been a pharmaceutical product that has been released that has completely cured everybody of the disease, that has prevented them from getting the disease in the first place, and that has had no known side effects. I mean, every single, like I said, the heartburn medicine that they wanted to put me on, there's a page of side effects when I did my research on that medicine. And then we had all of these doctors that told us that there would be no side effects, that these vaccines were safe and effective, that because they were mRNA, we could trust them, and that you could not get COVID and that you could not spread COVID if you got the vaccines. And I remember when I didn't get it, there were people that got, like people that I know personally, that were angry at me. And I mean, Joe Biden very famously got up on TV in I think February of last year and said that the pandemic that we were experiencing was a pandemic of the unvaccinated. But as time went on, it became very obvious that the vaccines did not protect you from getting COVID. They did not protect you from spreading COVID, and they often had side effects that went unaddressed by the mainstream media and the public health establishment. And so all three of the promises about these vaccines didn't come true. And again, I'm not a scientist, so I think that there may be, based on the evidence, some limited efficacy for certain groups of people to take the mRNA vaccines. But it's very, very obvious that the original narrative that these were like the ultimate panacea, that they were perfect, was not true. And many people were lied by the federal government because, again, these people have to know. These people had to know. And this is what made me so mad about the way that like our local doctors, we have one hospital, St. Elizabeth, that runs everything in Northern Kentucky, and all the doctors were 100% behind the COVID vaccine. You have to get it. 100% safe and effective. You won't get the disease. You won't spread it. All of that stuff. And it was so obvious from the beginning that they lied about it. And what was a really big eye-opening experience to me is that I wasn't vaccinated. I got COVID. I have my healthy lifestyle, and it was a piece of cake for me. But I had a lot of friends that were vaccinated, got COVID, and it just destroyed them for weeks at a time. Now, of course, like they weren't really like eating right during it. They didn't stay hydrated during it. And so all of those factors would make it difficult for them to recover from any illness at all, especially a novel illness like COVID-19. But it was very obvious that the vaccines did not actually help stop the spread of COVID. And so then it made me wonder, well, the only reason why they could possibly be pushing these and why there could possibly be so much propaganda surrounding the vaccines is because there were people that were making a lot of money on it. And what was really interesting is there was an article that came out over the summer, and this is in a publication called the National Pulse. And it says, New England Journal of Medicine, unvaccinated COVID patients are contagious for less time than those vaxxed or boosted. And they break down a study that was done by the New England Journal of Medicine over the summer. I'm going to read it real quick because it's a very short article. And they said, a study published in the New England Journal of Medicine showed that people vaccinated against COVID-19 remain contagious with the virus for a longer period of time than their unvaccinated counterparts. The disparity in contagiousness was particularly pronounced between the unvaccinated and individuals who did not receive a booster shot. The findings were published in a letter to the editor signed by dozens of doctors from a variety of hospitals in Boston, Massachusetts, and the prestigious New England Journal of Medicine in June. From July 2021 through January 2022, researchers studied 66 participants who contracted COVID-19, including 32 people with the Delta variant and 34 with the Omicron variant. Researchers compiled a variety of graphs tracking how long people remain contagious with the virus, using both PCR tests and viral cultures as indicator. When the data was separated into the categories unvaccinated, vaccinated, and boosted, individuals who did not receive a COVID-19 vaccine were contagious for a shorter period of time. Regarding positive PCR tests, within the first 10 days of contracting the virus, 68.75% of unvaccinated subjects were no longer contagious. In contrast, just 29.72% of vaccinated and 38.46% of boosted people were no longer contagious. 15 days into the study, 93.75% and 92.31% of unvaccinated and boosted people people, respectively, were no longer contagious. However, just 78.38% of vaccinated people weren't contagious. Really, really interesting finding. The study follows a host of similar reports and analyses conducted by researchers who deduced similar conclusions that undercut the efficacy of COVID-19 vaccines. Natural immunity has also proven to be superior in fighting against the initial infection of COVID-19. Despite these data points, which have been routinely censored by social media fact checkers, the White House and mainstream media have continued to uncritically promote COVID-19 vaccines. The embrace of COVID-19 vaccines by companies including Pfizer and Moderna follows massive lobbying campaigns and spending efforts by the pharmaceutical giants. And again, this all makes a whole lot of sense if you are approaching this from the perspective of holistic health. Anytime you put a chemical substance, a synthetic substance in your body, it almost inevitably has a weakening effect on your immune system. And again, if you look at the side effects of a lot of these drugs that have been out for a long time, like the heartburn medication that my doctor wanted to put me on, one of the side effects is immunocompromisation, if that's the correct way to a compromised immune system. And it's because your body is naturally good when it's being given all the nutrients that it needs to survive and it's properly hydrated. Your body's biome is naturally good at fighting off these illnesses. Like, we are hardwired to fight off these kinds of sicknesses. And when you introduce chemical substances into your body, that always decreases your ability to fight off any illnesses. And I think it's one of the reasons why a lot of people are perpetually sick. It's because their immune systems are wrecked by dehydration, by a sedentary lifestyle, and by not getting enough nutrients from their food. And again, this is the majority of Americans fall into one of those three categories. And so it makes sense that when people got COVID-19, they would be very sick. But the idea that these vaccines might actually have a negative effect, they might actually make you sicker, actually makes a lot more sense. And I've listened to a lot of podcasts and I've done a lot of reading from doctors like Dr. Malone, who have been, and Jay Bhattacharya, who have been against the COVID regime from the beginning. And what they have explained to me, and you can track this down yourself, but what they have explained in their writings and on their shows is that with the mRNA vaccines, it tends to, in certain people, spike there tends to be an increase in the spike proteins in their body, which makes it more likely that when they contract the disease, it will stay in their system for longer. It will make them contagious for longer, and it might actually increase their risk of long-term effects from the vaccines, which again, a lot of pharmaceutical products do, which is why it's always better to try to eat and exercise your way out of illness than use a pharmaceutical cover-up that will lead to all kinds of other health problems later on down the road. And this vaccine is not special or unique in that case. But the media has been very reluctant to cover that up. And the reason for that is very obvious. In the exact same way that the FDA gets all of these regulatory fees from the pharmaceutical companies, and that's how they're able to pay for their regulation, which is in essence regulatory capture of this government agency, which leads to this kind of corporatist system where these massive companies have regulations that benefit them and their product, and it crowds out other alternatives in the market, including holistic alternatives, which is one of the reasons why, like, you go to the store and you get vitamins and they'll say this has not been approved by the FDA. Of course, because the regulators at the FDA and their pharmaceutical allies don't want people being healthy, because the FDA won't have drugs to approve and the pharmaceutical companies won't have drugs to sell if Americans just take care of themselves. So that all makes complete and total sense. But again, it's the exact same kind of factor that happens with the FDA with these mainstream like tech companies and with these mainstream media outlets. So if you look at a lot of the umbrella corporations that own like Fox News, Fox News was very pro-vaccine. You look at the umbrella corporations that own CNN, Facebook, Google, all of the parent corporations of those companies have massive stock in pharmaceuticals, whether it's Moderna, Johnson & Johnson, Pfizer. So these companies are making money on the side on these pharmaceutical companies. And it's actually really obvious with CNN, Fox News, and MSNBC. If you ever watch any of their primetime programming, look at all of the advertisements that are on those shows. It's all pharmaceutical products. Like all day long, all they're pushing is pharmaceutical products. And so there's no economic incentive for these companies or for these news media outlets to fight against vaccines that are making their sponsors and making their advertisers a lot of money. It's this vicious circle where they promote vaccines so that their advertisers and the people that are paying their companies are making a lot of money. And so they're going to promote the very products that those companies are trying to sell. And one of the really horrible things about all of this is that there have been negative side effects that have been documented by many, many people across the globe because of these mRNA vaccines. And I think that one of the worst things that we can do, especially if let's say that you're a progressive and you believe in justice. And the reason why you wanted everyone to get the COVID vaccines to begin with is because you bought into the propaganda. You bought into the lie, you bought into the narrative that the vaccines were 100% safe and effective, that they would stop transmission, and that they would prevent you from getting them. And you said everyone should get these based on that because this is going to keep everyone safe from this disease. Like I don't agree with that, but that's a logical conclusion that you can come to. But now we have a ton of undisputed evidence that these vaccines tend to cause heart problems and other issues in people that take them, and we're not even allowed to talk about that. And so the very people that were so concerned about the health of others that they wanted to force and mandate everyone to get vaccines are the same people that are refusing to acknowledge that these vaccines might actually cause health problems in certain people. And again, I actually think that it's going to cause health problems in a lot more people than even the mainstream media is admitting right now. What's really interesting about this, though, is that like even the CDC has been reversing their position on a lot of these issues. For those of us that have been against the COVID regime from the beginning, the last 8 months have been extremely vindicating because almost all of the propositions that were made about masking, about lockdowns, about the complete efficacy of the vaccines, almost all of them have been quietly overturned, even by like the propagators at the CDC who are pushing these things from the begin with. So it's really, really interesting. But there are people out there that are being injured by the COVID vaccine. And it seems to be that myocarditis and pericarditis are the two greatest vaccine injuries that are associated with the COVID-19 vaccine. And there's just no way around that. And again, if you really care about the health of the average person, like if you're a really compassionate person and you want the best for people, then the least that we can do is acknowledge as a society that there are going to be at least some people that will have dramatic side effects from these vaccines, and that we should be able to go and have a conversation with our doctor about whether or not these vaccines are right for us. And I think for the majority of people, instead of getting the vaccine, they just need to change their diet and they need to change their lifestyle choices, because that would be the thing that would be the most effective, not just for preventing all of the deleterious effects that could come with having COVID, but also, all of the deleterious effects that come from living. Like you're just much better off in this world if you're a healthy person. But I want to share one more source of information, and this comes from a website called Green Med Info. They're a website that I occasionally read. They're holistic medicine. They're all about natural healing and things like that. Again, not in like the witch doctor kind of way, but just like actually putting vitamins and nutrients into your body. And they had a really interesting piece that they released a couple months ago about sudden adult death syndrome. And so they have just kind of a highlights at the top of the article I'm going to read, and I'll post a link to this article in the show notes so you can read it for yourself. But it says this. It says, in recent weeks, media outlets around the world have started highlighting a medical phenomenon called sudden adult death syndrome, or SADS, in what appears to be a clear effort to obscure the reality of COVID-19 vaccine deaths. Underlying factors for SADS include undiagnosed myocarditis, inflammatory conditions, and other conditions that cause irregularities in the electrical system of the heart, thereby triggering cardiac arrest. While SADS has been known to occur previously, what's new is the prevalence of this previously rare event. In Australia, the Melbourne Baker Heart and Diabetes Institute is setting up a new SADS registry to gain more information about the phenomenon. Data compiled by the International Olympic Committee show 1,101 sudden deaths in athletes under age 35 between 1966 and 2004, giving us an average annual rate of 29. And they're going to say that this is across all sports. Meanwhile, between March 2021 and March 2022 alone, a single year, at least 769 athletes have suffered cardiac arrest, collapse, and/or have died on the field worldwide. Among EU, FIFA, football, soccer ball athletes, sudden death increased by 420% in 2021. Historically, about 5 soccer players have died while playing the game each year. Between January and mid-November 2021, 21 FIFA players died from sudden death. Again, the only thing that has changed between now and then, it's not global warming, it's not racism, it's the fact that everyone was encouraged to get the vaccine. And this is obviously causing negative health effects in many people. And we have to be able to get to the point as a society, if we truly want justice, and if we truly want compassion, and if we truly want best for people, we have to be able to have this conversation. I know that it doesn't make your favorite pharmaceutical company a lot of money, and I know that there are many people in the government and in the mainstream media that might have to get out and retract and make apologies for the bad conclusions that they came to based on their junk science. But it is just very, very obvious that this is harming at least some people. And again, because I'm skeptical about the pharmaceutical companies to begin with, I think that as time goes on and as more and more people are willing to talk about this, these data points that we've discussed in the show today, I think that we're going to get to a point where more people are going to be open to the fact that these vaccines were very dangerous. And now that we are at a point where it's incontrovertible that the lockdowns had a much worse effect than anything that they would have prevented from happening in terms of the spread of the disease, we just have to get to a point where we can have those conversations as a society. And again, I think that if you're listening to this right now, I think especially if you're a Christian, we have to be very compassionate about this. And again, for those of us that have been skeptical and kind of been vindicated by the recent data that has been coming out and by some of the mea culpas that have been released by people that were commenting on this incorrectly all along, like, it's very easy to want to take a victory lap and say, look, like, we were right the entire time. We showed you guys that this was true. People are getting hurt by this. And even if people don't have complications from the vaccines in the long run, they were still forced to put or encouraged to put a substance in their body that wasn't good for them. And then again, like, from a bigger picture perspective, like, instead of doing what we should have done, which was stepping back, thinking about why our society is so unhealthy and trying to make dietary and lifestyle change to make us all more healthy and better off, we didn't do that at all. Instead, we just pushed more vaccines and we prevented people from thinking about their health in a holistic way that could actually free them up to live better, healthier lives. So this wound up going a little bit longer than I wanted it today. I am planning on releasing this as like a midweek special. I got a lot of great interviews lined up over the next couple of weeks, and I just been reading these articles and I wanted to get something out because we hadn't addressed it on the show. If you think there's something I missed, or if you think that there's something that I would like, that you would like me to talk about in the future, or if you have a recommendation for somebody that I should try to get on my show, like, realistically, like someone like Malone or Bhattacharya is not going to come on the Protestant Libertarian podcast because I do not have a big enough following for that. But if you can think of somebody that I might be able to realistically get on my show and you would like to hear from them, I would love to get an expert on, like someone who really understands like the physiology and the biology behind the disease and behind the vaccines to talk about that. Please feel free to reach out to me on Twitter or email me at theprotestantlibertarian@gmail.com, and I'd be happy to address that. Guys, thank you so much for being with me on the show today. I know that you have gotten bits and pieces of this on other podcasts and in other media outlets, but hopefully this was just kind of a good way of addressing COVID-19 for the first time in a big picture fashion on this show. Thanks again for making it to the end, and we will see you guys on Tuesday. Thanks for listening to another episode of the Protestant Libertarian Podcast. If you have any questions or comments or thoughts about the show, please reach out to me at theprotestantlibertarian@gmail.com. You can also follow me on Twitter at ProLibertyPod. Again, you can follow me on Twitter at ProLibertyPod. You can also support the show by leaving a rating or a review on your favorite podcast app. Thank you guys so much for listening, and we'll see you next week.